the department, and welcome to our Community First Choice Council meeting for January. All right, next slide. Our mission at the Department of Healthcare Policy and Financing is improving healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. Okay, so Happy New Year, everyone. Excited to see you all after the holidays. So today we have a fairly light agenda. We just have an hour today, and we'll be going over our typical CFC overview and enrollment update. And then we have an update around difficulty of care, and then a plug for our code of regulations updates that we're making. And then we'll have some time for open forum. Just a reminder, we are recording this meeting. We post our meeting recordings on our website. And in order to do that, we cannot have any PHI or protected health information shared. So please refrain from sharing any protected health information on this meeting. If you need any accommodations, please reach out to our civil rights officer at HCPF, HCPF 504 ada@state.co.us. If you reach out, usually within a week or two before our meeting, they can help make any accommodation arrangements for our next upcoming meeting. Alrighty, so for those of you who are new to this meeting or new to Community First Choice, I'll just give a brief overview. So CFC for short is a program that states can choose to implement, and it allows us to move a certain set of HCBS waiver services out of those waivers and onto Community First Choice, where it lives within the state plan, and those services become accessible to all waiver members, regardless of their waiver program, and to members on the state plan who meet an institutional level of care. So as of July 1st of 2025, when we launched CFC in Colorado, we moved all the services on the left-hand side of this screen to Community First Choice, including our 2 participant-directed service delivery models in Colorado, in-home support services, or IHSS, and consumer-directed attendant support services, or CDAS. So we have expanded access to these 2 models and the services on the left-hand side of this screen to, again, all members regardless of their waiver program, and to eligible members on the state plan. Okay, as of now, we have a little over 17,000 members successfully enrolled in CFC, which is very exciting, and almost 700 of those are CFC only members. So as you may recall, CFC launched in July 1st of 2025, but has a rolling enrollment throughout this transition year, which lasts until June 30th of 2026. So if you're an HCBS member receiving services that are moving or have moved to CFC, you will enroll into CFC to receive those services under CFC at time of your continued stay review. So we'll continue to see that number grow throughout the year, and then at the end of June, 2026, we will essentially close out the services under the waiver programs that have moved to CFC. In July of 2025, we also, thanks, Julie. In July of 2025, we also launched our new children's waiver, the Children with Complex Health Needs waiver, which essentially merged the Children's and Community-Based Services waiver into the Children with Life-Limiting Illness waiver. So enrollment onto that new waiver for CHCBS kids is also rolling. So at this time, we have a little over 1,000 children on that new waiver, and they'll enroll throughout the year at their CSR, or their continued stay review. And then all members who were on the CLLI waiver were automatically switched. The name of their waiver was switched on July 1st of 2025. So enrollment is continuing to go as expected, but again, please reach out if you're seeing anything that seems off, or if you're experiencing any issues. We really appreciate hearing directly from you during this transition year, as we know it's a big learning curve for you, for members, for case managers, for providers. A lot launched in July of 2025 in the summer. So we know it's been a big transition this year, and we continue to appreciate hearing from you if you're experiencing any issues. It helps us kind of target where we may need to solution or shore up any miscommunication or misinformation. Okay, I'll now move into our update around difficulty of care. So just a little background around difficulty of care. So for live-in caregivers who provide direct care services to members on a waiver program, those live-in caregivers can apply for what's called a difficulty of care exemption, which essentially allows them to exclude the payment they receive for those services from federal income tax. So because we moved direct care services from our waiver programs to Community First Choice, we asked the IRS last year in February 2025 if the same exemption could apply under our CFC program. Now, for a handful of reasons, including just the general slow nature of the IRS and the federal shutdown, we were delayed in hearing back from them, but we finally did, and the decision they gave us was good. It's favorable. They basically said, yes, under CFC, you can apply the same exemption for difficulty of care that you do currently for the waiver programs. So that's very exciting. That was the decision we expected to hear and we wanted to hear, and we finally got it. So that's great. So now that same exemption applies for live-in caregivers who are serving members of CFC. Okay, so we know this was difficult. We know this was hard over this last 6 months. This is a complex issue, and we appreciate your patience as we waited for this private letter to come back. And we know, this alone doesn't solve everything, but we are now excited to move forward with this information from the IRS and to help navigate this exciting change as best that we can. So, and you can go to the next slide, Julie. So while over the last 6 months, while we've waited for this private letter ruling from the IRS, we know that many provider agencies and our FMS vendors decided to withhold income tax from their caregiver wages under CFC, just in case the ruling was not favorable. They didn't want to take on any risk there. And as a state agency, it's not within our purview to, we can't require that these agencies or the vendors, do anything specific with their tax withholding practices. So now that we have the ruling back, we have encouraged those agencies and our vendors to reconsider, reconsider that practice, as income tax no longer needs to be collected from difficulty of care qualifying wages. Sorry, I'm still recovering from a cold over the holidays, so I apologize if my voice is a little raspy. But all that being said, we encourage you to reach out to your provider agencies, to your vendors for more information. And ultimately, we can't provide legal or tax guidance on this issue specifically, but we have linked a few tax resources that are low cost and free from the Department of Revenue's website. And we do have a link to our private letter ruling from the IRS. And then an updated memo will be posted shortly with more information. Yeah, I'll just get through. Megan, I see your hands up. Sorry, I'm continuing to lose my voice. But I'll take questions just after my final slide here on this topic. So just hold tight for 1 second and I'll get through the rest of this. And Julie, we can go to the next slide. So I know there are two parts to this. So for the tax side, again, we can't provide any specific guidance, but we'll continue to share what we can and to assist where we can and where it's within our purview. But for the eligibility piece, as we know, many live-in caregivers who have the difficulty of care exemption need that exemption to remain Medicaid eligible. We had issued guidance previously in a fact sheet for eligibility workers that essentially recommends that the member that the live-in caregiver provides services for remain on a waiver program. That guidance still stands for eligibility purposes while we need to update our internal systems. So our internal eligibility systems still need to be updated to reflect CFC only members for this difficulty of care exemption. So while we do that, we still encourage members to remain on a waiver program in order for their live-in caregiver to continue to receive the DOC exemption for eligibility purposes specifically. Okay, I know that was a lot of information, so I'll pause here and I'll take some questions. And I apologize for my voice. I'm going to try to just continue to drink water throughout the meeting so I can talk. Okay, Megan, I think your hand was up. Right.
Yes, but Carol put the memo in the chat that was posted as of today. Hooray, which was going to be my question. Like, it's time for people to start doing their taxes. So how soon is soon for the memo? And apparently today. So we're good.
Yes. Yeah. Awesome. Thank you. Okay, any other questions or anything from the chat? Oh, Megan, go ahead.
I'll throw this one out, which may or may not apply for you all, but we're hearing some providers say that respite is considered difficulty of care, which all of my understanding has been that respite is not and pretty much never considered difficulty of care. But wondering if that's written somewhere so that's consistently applied.
That's a good question. I have not seen anywhere that respite, applies to this exemption. But please, anyone, Maddie from my team, correct me if I'm wrong there. But I don't believe respite applies. But we can take that back and double check. Unless Maddie, you know.
I don't know off the top of my head. I know it the way the IRS lists out the services is confusing and not specific, which probably isn't surprising. But I need to pull up the actual regulation and I'll pop it in the chat just to see exactly what the IRS says.
Okay, thank you so much, Maddie. Okay, any other questions about difficulty of care? Okay, Maddie, anything in the chat that I may have missed? Lana, go ahead.
Eileen, there is a question from Jennifer in the chat. She's asking for clarification on select services. And I think that Jennifer, we'll get back to you on that because I think the rest is probably the one in question. But Eileen, do you mind just spending a second to clarify that which services we know do not qualify for the difficulty of care status, for example, PERS provider?
Right, yes. So the services, any service that's not considered a direct care service provided directly by a caregiver in home wouldn't be considered for difficulty of care. So under CFC, that wouldn't be PERS, that wouldn't be transition setup or home delivered meals or electronic monitoring. Again, we'll confirm, but we're thinking direct care under CFC applies to personal care, homemaker, health maintenance, under our service, our participant directed service delivery models as well. So, okay. Victoria, I think your hand is up.
Yeah, I had a quick question. You said under the CDOS that certain services on the CFC may be tax exempt. I'm just curious if you're going to be putting out a memo or any direction so that CDOS members and case managers that handle that can figure out which one of those would be, because I was just in a CDOS meeting yesterday and that was still a very confusing question even for the CM I was working with.
Thank you, Victoria. Yes, we have a memo coming out today that provides more detailed information about this topic and about next steps with your FMS vendors and for those who are on CDOS. And I see Danny, you've got your hand raised, so I'll go ahead and punt it to you.
Thank you. Good question, Victoria. I just wanted to add a little bit of information about what you can expect from the FMS vendors. So each of the FMS are managing difficulty of care payments. There should be information coming from each specific FMS very shortly. I believe PPL has already sent some information to members and attendants, and I believe Palco will be soon if they haven't already. In addition, Consumer Directive Colorado, the training vendor, is working on putting together some specific CDOS resources just for attendants and members to better understand how they may access difficulty of care, what tax resources might be available, etc.
Thank you, Danny.
Yeah, and I'm sorry, I would also add for members and attendants, the best thing you can do is contact the customer service of your specific FMS to get more information about how you're impacted and how you can access the service, or excuse me, the exemption.
Okay, perfect. Alrighty, and again, we'll continue to share as much information and as many resources as we are able to. As we know, this is complex and a challenging topic. So, again, please reach out if you have any questions, and we'll continue to share more information as it becomes available. Okay. I think I'll move on to our next section then, and then if any other difficulty of care questions come up, we can take those during open forum. Okay, so we have a brief rules or code of regulation update, very similar to the update that we gave last month. So as many of you probably know, OCL has put forward, or our Office of Community Living has put forward a number of actions to slow the trend growth within long-term care in order to comply with our governor's executive order issued in October of 2025. So in order to operationalize those actions, we have to make certain rule changes to certain sections of rule, and those changes are going as an emergency rulemaking process. So because our timeline is pretty short here, and we need these changes effective for April 1st, and we have to have case managers able to service plan with enough time for those April 1st certifications. We are taking these rule changes through the emergency rulemaking process. Next slide, please. So these changes, what to expect, they are updating the rule changes to reflect the new caregiver limits and the soft cap service limits to comply with the governor's executive order. We're also clarifying definitions and just kind of cleaning up a few definitions as well. So we have posted our rules in a redlined draft on our website, since those have been posted since December 19th for your review, and we are taking feedback via a feedback form. But please know we can't change the limits themselves, but we are seeking your input on the language associated with the rule changes. And we're taking feedback until January 15th. So please continue to review those if you are reviewing them and provide us any feedback. We do have an update for the rule draft that you will see posted that includes a few changes around the nurse assessor and health maintenance activities. So if you are you'll see those changes now reflected in the draft online that's been posted. So, but no other changes have been made to the rest of the content of the rules. So these new changes include removing references to the nurse assessor and the skilled care acuity tool, along with updating the health maintenance activities definition to align with what we have in statute. We're also replacing nurse assessor language in health maintenance activities with documentation requirements for service authorization. And then we're clarifying how many legally responsible persons can be paid for homemaker, along with a few other formatting errors. So you'll see those changes in the draft that is now linked online. Right. And then as far as the timeline goes for these rule changes, again, we have the feedback session open until January 15th. And then the following month on the 13th of February, we'll be taking these rules to MSB for our emergency rule hearing date. And then on April 10th, we will have our final hearing and our final approval, and then they will be effective on May 30th of 2026. Oh, excuse me. So before we go on to this next section, Julie, I'll just pause and make sure we don't have any questions about these changes. Victoria, go ahead.
Yeah. So what I would like to address is the elephant in the room, because all of your language on all of your memos and anything that you've sent out publicly says soft caps. And that document you just had on your slide says that you guys cannot change that from a soft cap to a hard cap. But yet internally, from my understanding, you guys have been telling CMs that this is in fact hard cap. And that even though there's an exemption process, that exemption process will be almost impossible. So I just wanted to make sure that you're not just waiting on regulations to be able to change that from a soft cap to a hard cap, and that this is in fact soft caps, and we're not going to be sprung on us 6 months later that it's a hard cap or have pretty much all of our exemptions denied.
Thank you, Victoria, for that feedback. At this time, we have no intention to change those soft caps to hard caps. So what is reflected in rule now is what we intend to see effective April 1st of this year. Okay, Laura, see your hands up.
My question is if these are going through and they're effective April 1st, the cap on caregivers being allowed to work more than 56 hours a week, is that effective immediately April 1st, that agencies have to make those adjustments to schedules, CDOS attendants have to make adjustments and find staff by April 1st to cover the hours that are being let go by the people currently covering it? Is that the expectation?
Thank you, Laura, for that question. So all the operational details around the changes, the sustainability action changes, those details more are coming out. Excuse me, my voice continue to keep losing it. We have memos coming out very soon that kind of go over more details around how the department will operationalize these changes. So I will wait to, answer any questions about those changes until the memos come out and those have more detail. Yes, Colby.
Hi guys, appreciate you guys going through all this stuff. I just wanted to kind of piggyback off that a little bit. I understand that, again, it looks like the permanent rule obviously is effective on May 30th for these changes, but I think there is a misconception and a difference between waiting for these pieces and what's actually happening in the community. And I work with a provider, but we have already seen these changes being implemented pretty strictly already. And so any kind of communication that could be consistent between case management agencies, providers, and members, as far as kind of those operational pieces, would be greatly appreciated, because everyone's kind of pointing the other way and trying to figure out what the actual and accurate information is, and no one's really speaking the same language right now. So anything you guys can do would be super helpful.
Thank you, Colby, for that feedback. We'll definitely take that back and appreciate you saying that. I'll also mention we do have case management training coming up in mid-January. So more details will be going out to case managers specifically at that time, including more operational details. Okay, I think Teresa, got your hand up.
Good morning. Thank you. This might seem like a really stupid question, but I just want to make sure I'm understanding everything correctly. So I have 3 sons that are on waivers. 2 of them are on a DD waiver, and then another one of my sons recently got on the SLS waiver. When he was on the SLS waiver, when it was approved last year, I don't think falls under CFC just yet. I think that will start this year, was my understanding. My question is, with the 56-hour-a-week cap, how would that apply in my situation? Is that applicable? I'm not providing more than 56 hours to my son that's on SLS, but my sons on DD obviously are 24/7.
Thank you for that. So at this time, again, we can't speak on kind of the operational details of these changes with specifics to your individual situation. So I think, once case management training happens, we'll have, more direction going out to case managers on how to talk through with members about how these changes will impact you specifically at your upcoming service plan. Okay, I think Victoria, I see your second up on my screen.
Yeah, actually, I forgot, I would love to bounce off what Colby just said. A lot of the information that we have prior to December 15th is that you guys weren't going to implement any of these changes until April. However, it has already started. It's already started between Christmas and New Year. And I can testify to that fact because I'm one of those families. I also am hearing from my contacts that you guys have already started this, that you are expecting all of the cases to be done through the new age appropriate calculator by April 1st. So we would like to know, when did this start? What is the deadline of it being completed? What is your group chosen, average, whatever, throughout agencies for how many cases have to be done in a certain time period? And for the families out there, when can we expect for the age appropriate calculator to be implemented on all cases across the state of Colorado?
Thanks, Victoria. I'm going to go ahead and pass it to Cassie for this one to kind of give more details on the direct care services changes.
Sure. Thanks for your questions, Victoria. I think there's probably some confusion, conflation between a lot of the new initiatives, which I think is absolutely reasonable to expect. We have a lot coming down for members, their families, case managers, providers. The new caps, the soft caps, will absolutely be a soft cap. That is a kind of ceiling on what is allowable for services. Anything beyond that requires an exception through the exceptions process that is outlined in rule. There is, at this point, zero intention to move that to be a hard cap. I think in addition to that, we have the new direct care service calculator that has task standards, revised task standards that case managers are using now to conduct their work. Those task standards are firm, but as with a lot of our things, there is some wiggle room there, and there is allowable exceptions to exceed those task standards. Case managers are expected to be using the new direct care services calculator now forward. They are absolutely not expected to touch their entire caseload between now and April. That is silly and unreasonable and not something that we are expecting. We are asking case managers to begin using that new calculator if they're doing revisions or for any of their work that they have started now for cases that are April 1st and forward. These changes, soft caps, caregiver caps, none of that is effective until April 1st. However, case managers work kind of behind, and so they work on their cases leading up to there. So there are conversations happening with members, there's service planning, all of that is happening. But again, those things are not effective until April 1st. So your case manager may be talking to you or your friends, or those conversations may be happening, but they're not making those revisions to your PAR today. So rest assured, those cases don't need to be touched. What we are asking for case managers to do is make sure their entire caseload is revised with all of these new initiatives by November of 2026. And so that will begin happening now, effective April 1st. And then for all of those folks who receive services, all of those service plans, they do need to be revised, or they'll go through their continued stay review by that November date. But we have no expectation for all of that to be done now. As we talked about, I said there's a lot of confusion, and so we have that very comprehensive case management training next week for case managers. There's going to be lots of resources for them, and so we're hoping that they will have all of the tools that they need to have those conversations with you all, with families, with members, to talk about these initiatives, and hopefully some of this confusion will be cleared up by that training. We're then following that on the heels the following week with the provider training to provide providers with all of this same information that says these are these initiatives, this is the work that providers need to do to make this effective. So that is what is coming. I get that maybe perhaps some case managers are not following this direction. We've been very clear of what some of this process is, when these items need to take place. And I'm sorry to hear that case managers may not. We are biding our time till next week when they get that training, and hopefully anything case managers are doing perhaps in error, applying in error, will be course corrected next week. But that is hopefully what that provides you, that information, that clarity on what the timelines are, what those expectations are, and then what these different initiatives are.
Thank you, Cassie, for that. It's very helpful. Okay, I think Teresa, I see you have your hand up next.
Sorry, I just forgot to lower it.
Okay, no problem. All right, Jennifer?
Yes, I had a question to clarify the new language added to the homemaker provider services reimbursement requirement. Bullet 5 states the update that was added was that a member may have up to 2 legally responsible persons that are paid to provide homemaker services. Is the 260 hours of homemaker services annually, is that per legally responsible person or split for up to 2 legally responsible persons?
Great question. Oh, did I freeze? Sorry, I saw myself froze. Member can have up to 2 legally responsible persons. Each can provide 5 hours of care to that member. Does that help?
Yes, thank you very much.
Okay. Okay, Jerica, go ahead.
Yes, my concern is I actually just got off the phone with my case manager and she's already starting to meet with clients on her caseload, making all of these revisions. But I just caught the call where you guys were stating that you guys were doing a comprehensive one next week. My concern is that if they're not truly informed, and I've had to kind of correct my own case manager on some changes, I guess my concern is that if they're already making these impacts and making these adjustments without comprehensive training, that there's just going to be more errors. So were they given the green light to start making the revisions for their direct care calculator?
Great question, Jerica. So, again, we'll reiterate everything Cassie kind of just said. And I don't know if Kidron, you're on the call from our case management team, if you have anything else you'd like to add that Cassie didn't already speak to in her previous response.
Good morning, everybody. My name is Kidron Backus. I'm the case management operations section manager. And I just want to, again, reiterate what Cassie stated, that we want to make sure that people are understanding that there have been regulation changes that are already effective for the direct services care calculator. And so if you're having a revision to your service plan that is in alignment with those new regulations and definitions of those services, that is happening and should be happening, and case management agencies have received that direction to do revisions based on that regulation change and expectations for using that direct services, the DCFC. So if that is happening, that should be happening because it is effective immediately with that rule being promulgated. The changes for the Medicaid sustainability actions is what we're talking about, that case management agencies will be receiving that really robust training next week. As Cassie pointed out, there has been much effort to be thoughtful about how to implement these changes, the timeline of how we're implementing these changes, making sure that we take the time to do it in a really purposeful, meaningful way throughout now, like getting the training for case management agencies, having changes effective April 1st going forward, making sure that people have the opportunity to have either a monitoring contact or continued stay review through November of this year. And so it's not going to all be effective April 1st for every single member in our waiver programs or the CFC programs. It is going to be a year, 10 months of work that we're going to be doing with
spacing it out. And I just do too, because even though we just did that and she just said that it would be 5 hours for each caregiver, my case manager did not mention that at all. So I guess this is where I'm glad I'm attending, so I can follow up with them to make sure that they are informing people that it's per caregiver. So thank you for reiterating. I jumped on very last minute. And I apologize for taking up that space.
It's really okay, because that's why we're here, right? That's why we're having this engagement, because we want to be as transparent as possible. We want to hear your concerns as much as possible, because this is really important work and things that we're doing right now. So we want to create this space for you, and we want to hear those concerns. So we really, really hope that the training next week is really what is going to support case managers and case management agencies in this work, because we want to do that really thoughtfully. I'll hand it back over.
Thanks, Kitchen. Megan?
Yeah, just I could echo very quickly, like it's a circus out there. Like it feels like the Wild West, that everybody's doing kind of different things, and each case management agency is doing different things. So I think we definitely need so much more training. And I'm glad it's happening, and I really, really hope that that is effective at making it way less chaotic and more consistent. My real reason for raising my hand, though, was looking at the CFC and Community Connector rule revision draft, the red line draft that you have in there. I'm concerned about some of the language in the age-appropriate test standards and the test standards for adults, particularly the last line that says the length of time appropriate per task and the maximum time permitted per task. According to the DCSC, it has things outlining how someone could exceed those maximums that are listed there with supervisor approval, but the way the rule is written makes it sound like it is a maximum and there is no flexibility within that maximum, which feel in conflict with each other. So I appreciate that the DCSC seems to acknowledge that not everybody fits in a set box, particularly with health maintenance activities, that those really, really don't fit in nicely prescribed boxes for everybody, but the rule does not seem to acknowledge that, which makes me concerned that exceeding those maxes will not be allowed or not be allowed ongoing, even with CMA supervisor approval.
Thank you, Megan. That's helpful feedback. If you are able to issue your feedback through the form, that way we can look at exactly what you're looking at and kind of make sure we're understanding like where we might need to make a language adjustment to make things more clear, to make our intentions more clear. I think that would be the most helpful. So feel free to fill out that form and we can go ahead and take a look at that. And then to your first point, again, yes, we absolutely know that there is a lot of confusion out there right now. The one thing I'll add is that we are in the process of reissuing our direct care services calculator memo that should help clear up some of that confusion and aligns with what Kidron and Cassie spoke to earlier, and that more memos are coming along with the training. So hopefully over the next week, 2 weeks, we will get everyone aligned. So I hope that helps. Okay, I see Deborah. You've got your hand up next. I can't hear you if you are talking. Still can't hear you. Shoot. Okay, well, Deborah, we'll come back to you. So I'll circle back. But I think Laura, you're up next.
Yeah, so this was just in regards to the case management training. Thank you. I know that's a lot like a telephone game where you guys say one thing and then what they walk away from can be taken differently and misconceptions begin there. So I know that is probably the hardest part of your job, is that education. But if we could add into that we're getting a lot of like, you need a doctor's order for us to justify that care. And I know the word order is like a big no-no, especially if you're a non-medical agency that is providing health maintenance. And so like, I want to make sure that we're overemphasizing in that education that we're not requesting orders, but we're requesting documentation from the physician supporting the need for that task, and that it's not being called an order, because as soon as it's an order, we can't technically do it. And so I just want to make sure that in those trainings that we're emphasizing that a lot with case management, because what they're walking away from with that as being documentation from the physician is they're automatically calling it orders. And I think doctors are going to get confused. Doctors are going to start pushing back, wait, what am I writing an order for? And so I just want to make sure that that is being clarified in that education that you guys are doing.
Thank you for that, Laura. I will go ahead and pass it to one of my colleagues on the participant-directed team if this is more specific about HMA documentation. So, Danny or Amanda, if you're on and able to speak to Laura's comment, that would be great.
Thanks, Eileen. This is Danny. I can go ahead and speak to this. Good question, Laura. Definitely something that we identified as a need as well. And so this was something we were actually discussing just yesterday about how to clarify that in training materials that are coming out about differentiating specifically between an order and a prescription and things of that nature. You might have referenced, you already saw the HMA documentation memo did come out yesterday. I'm hoping that that has some clarification about documentation requirements. But just to address your concerns, we completely agree. We are not asking for doctor's orders for all HMA. We're not asking for prescriptions on all HMA. There is a list of tasks which can be found in the member checklist or in the DCSC, there's like the member documentation guide. Within that version, we also have just some like a list of documents that can be used to substantiate HMA. They're not necessarily orders. It's not necessarily anything that needs to be signed by a physician. I would say the caveat would be for like home exercise plans for exercise. That one does require home exercise plan to be filled out by a medical professional. And then obviously like the physician's medical, the professional medical information page, the PMIP, when the services start or, when you're initially authorizing for services, that also would need to be signed by a licensed medical professional. But otherwise, we're definitely not looking for orders specifically. Does that answer your question?
Yes, I know that's not what you guys are asking for. I'm just wanting to make sure that the education is there for the case management, because then they're coming to agencies and saying, hey, I need orders. And I just want to make sure that that's clear across the board to everyone that using those terms, except for where it needs to be those exercise plans and etc.
Okay, thank you for that feedback. That is something we're aware of, but I'll make sure that our materials coming out, if there's any places where we can hit home a little harder, that distinction, we'll do that.
Thank you so much, Jeannie. Okay, I think Victoria, you're up next on my screen.
Yeah, so if you are not aware, I run Impacted Caregivers of Colorado. It's a group of almost 2,000 family members. We're very well known on Facebook for posting updated information, gathering information from families and doing advocacy. And I can guarantee you right now, we have the evidence to prove it, that families are already being impacted by implementation of the caps, already being impacted by the implementation of the new calculator for age. We have been told that they are advised to do it not only during the annually, but at the quarterly as well, to be able to get all these cases done. I know that I have a meeting coming up for my son on the 9th. His annual is not due until June. And I've already had the conversation with my CM where they are implementing the 6.8 cap, the 5 cap, the 7 cap. and that they're already cutting me down to the 56-hour-a-week cap. And they're putting everything through the new calculator. So if he's not due till June, then why is this happening now if you haven't even done the trainings yet and you haven't implemented the caps yet? And why do I have nothing but posts from other families freaking out over the fact that these exact same things are happening to them as well? I'm sure our entire group of families would love to hear your answer on that, because it sure seems like you're saying this shouldn't be happening. But if you guys paid any attention to any of the groups on Facebook, it is happening. And if it's not supposed to be, you guys need to put a stop to it. And if it is supposed to be, you need to tell us.
Thank you, Victoria, for that. I see Kidron from our case management team has her hand up. So Kidron, I'll go ahead and pass that to you.
Yeah, thanks so much, Victoria. Thanks, Eileen, for passing it to me. So I would like to first say that I'm happy to report to everybody on the call today that while we don't address things on Facebook groups, we do have a way to address specific concerns that any member has and is experiencing difficulty in their service planning with their case management agency. We have a HCPF grievance form that anyone that receives Medicaid services can submit to HCPF, and we can look at the specifics of your complaint or your grievance, and we can look at the specifics of your case and identify a really effective and timely path forward for a solution. We always encourage members to work directly with their case management agency as best as possible before coming straight to HCPF, but we can certainly utilize that grievance form in a way to address those concerns that people have. It's much more effective to look at the specifics of a case and identify where we might have pockets of misunderstanding at the case management agency level. And that also gives us really good data to look at the effectiveness of our training and our messaging and our resources to case management agencies. They are balancing a lot of information as well. And we want to make sure that at every level, case managers, case management agencies are providing accurate and timely information to members. So I want to just make sure Rachel, my colleague, posted that escalation form in the chat for you all. Again, my ask is that you try to directly address your concerns with the case management agency whenever possible, but please feel free to fill out that form if you need HCPF eyes on a specific case. So Victoria, well, again, circling back, while we don't necessarily participate in Facebook groups or online groups in that capacity, we do want to hear from members that are needing us to look at those specific cases and address your concerns.
Thank you, Kidron.
My pleasure.
Okay. Alrighty, I'm going to take one more question, and then since we only have about 5 minutes left, I just want to make sure we kind of run through the rest of our slides. I have one more quick announcement. So I just want to make sure we have some time for that. So Tara, go ahead.
Yeah, hi. I just want to make sure that I'm able to provide some guidance to our families that we serve. We do a parent CNA, and we also do IHSS with our agency. We have a lot of families that have been put through the ringer between the nurse assessors and now all the changes coming down with the budget crisis. And I need to be able to explain to my families why there's willingness to pay up to 100+ hours for these kiddos that, desperately need it for more than one provider. But with our single parent families, that you're only willing to do 56 hours. It's really confusing to them. And they're hearing it's because of caregiver burnout, but what they're actually going to be experiencing is major effects to their health and safety for their children, because they're not going to be able to maintain a job with their help with their kids. They're not going to be able to find caregivers that are trained enough to support their kids. And it's just these exemptions that are talked about, I think, are not going to be as easily to apply for as people think they will be. And I need guidance, and I've been asking for it, and I haven't seen it come out in any of the FAQs. I have not seen it come out from you guys. All I keep getting is I'm not prepared to answer that question. So do you guys have guidance today on that?
Thanks, Tara, for your comment. We appreciate that. As of now, we can't speak to the specifics of your comment, but we'll continue to take that back and continue to communicate more as more information becomes available.
So with these changes coming out, especially with case managers and service coordinators coming at these families, when should we expect this? Because again, Eileen, I know it's hard. I know you guys are dealing with a lot, but this is a very, very, very big concern for these families.
Absolutely. I completely understand. I know there's provider training coming after the case management training, which will give more detail. And then, Cassie, if there's anything else you'd like to add, please feel free. But that's all the information I have at this time. I apologize.
All right. Well, I appreciate it. Thank you. I think that there needs to be some clarity as to why it's not affecting the budget if you're willing to pay up to those amounts, but yet you're not willing to help the families that need it the most.
Thanks, Tara. Excuse me. Okay. So I know we just have a few minutes left, and I just want to make sure to get through our last couple slides here. So Julie, if you can move us to those last slides. So I just wanted to announce, and you can go to the next slide, Julie. Starting in this new year, in 2026, we are going to have our CFC Council meetings switched to every other month instead of every month. So our next council meeting will be in March, and it'll be every other month until June. And then once we hit June, which will be the end of our CFC transition year, we will then move to having these meetings on a quarterly basis. So, our CFC Council meeting was launched as our development and implementation council. So we have been meeting monthly for several years now to, request your assistance as we develop this program and launch this program. So now that CFC is launched and kind of chugging along, we do not need to meet quite as frequently as we previously did. That being said, if things come up and additional changes are being contemplated, we can absolutely add more meetings on to discuss anything ad hoc. But that is our plan as of now, is to kind of phase down the cadence of these meetings. So just want to make sure we announce that today. And then we'll move on to the next slide, Julie, or the next one. And one more. I think that has our contact information. Okay, perfect. So again, if you have any questions about Community First Choice specifically, please feel free to reach out to our email inbox. And it's hcpf_cfc@state.co.us. And then if you do have any feedback around the sustainability actions, please utilize the stakeholder comment form that is linked on this slide. That form goes directly to the team that is handling any feedback and comments around those changes. Okay, it is 11 o'clock exactly. So again, thank you for your time today. And again, we won't be meeting next month, but we will be meeting in March at 10 a.m. And the meetings will still be available on the stakeholder website. So we look forward to seeing you all in March. And thank you again for your time and your feedback today.